Hi friends, I am Mani. I am back again with another topic. Topic name is cell death. Okay, cell death. Okay, so in cell death means it is a irreversible cell injury. It is called cell death. So there is a mechanism of cell death. Mechanism of cell death. Here, first one is due to necrosis. Necrosis due to apoptosis. Third is necroptosis. Fourth one is pyroptosis. Okay. The fifth one is pheroptosis. And then last one is autophagy. Autophagy. So in this all mechanism, today we will discuss only necrosis. So necrosis, it is a form of pathological cell death. Okay. Necrosis, it is a form of pathological cell death. Okay. Cell death. Okay. So mechanism, here mechanism of necrosis. Mechanism, it is basically denaturation of protein. Denaturation of protein. Okay. Then also due to enzymatic digestion of cell. Enzymatic digestion of cell. Okay friend, this both is lead to damage plasma membrane. Okay, damage plasma membrane. Okay, so due to damage of plasma membrane, there will be all content will leak out of the cell. Content will leak out of cell. So when content will leak out of cell, so there will be inflammatory reaction occur. There will be inflammatory reaction. Okay, for clear debris. Okay, to clear debris, so there will be accidental cell death. Accidental cell death. Okay friend, so here is some types of necrosis. Types of necrosis. So here first one is coagulative necrosis. Coagulative necrosis. And second one is liquefactive necrosis. And third is caseous necrosis. Fourth is fat necrosis. Fifth number is fibrinoid necrosis. And then last one is gangrenous necrosis. Okay friend, gangrenous necrosis. So friend, here I will draw one very important table. So by table we will learn all types of necrosis. So here I will draw one table. It is very important table. So by this help of this table we will learn all types of necrosis. Okay, so here types of necrosis. Types of necrosis. Okay, so here our first one is we will write here coagulative necrosis. Okay, then second is liquefactive necrosis. Okay, then here is caseous necrosis. Okay friend, so in types, here is we will write notes. So coagulative necrosis, it is occurs in infract is a localized area. Infract is a localized area, okay, of coagulative necrosis. Coagulative necrosis. Okay, so here infract is a localized area. So it is a type of coagulative necrosis. It is a type of dry gangrene. Okay, dry gangrene. Okay, then we comes to liquefactive necrosis. So it is also called coagulative necrosis. Coagulative necrosis. Okay, and is basically it is due to enzymatic digestion of cell. It is due to enzymatic digestion of cell. Okay, and it is a type of wet gangrene. Type of wet gangrene. Okay, coagulative necrosis is a type of which type of gangrene? Dry gangrene. But liquefactive necrosis is type of wet gangrene. Okay, then we comes to caseous necrosis. So caseous necrosis, it is basically look like cheese like appearance. Okay, cheese like appearance. Okay, and then we comes to occurrence. Here is occurrence. Okay, so it is basically occurs in all solid organ. Coagulative necrosis is occurs in all solid organ. Occurs in all solid organs except brain. Okay friend, so here is it is very important. Coagulative necrosis occurs in all solid organ except brain. So do remember. So here some example like kidney, spleen, or heart. So in this, heart is most common. So do you remember friends, in coagulative necrosis heart is most common, and liver, etc. Okay, then we comes to liquefactive necrosis. So liquefactive necrosis occurs in any kind of injury like brain injury. Okay, it is occurs in any kind of injury like brain injury or any abscess. Okay, or any fungal infection. Okay, then we comes to means how necrosis is look like, means appearance. Microscopically how necrosis look like. So in microscope microscope. Coagulative necrosis is when we will see by microscope. So coagulative necrosis, cell outline will preserved. Cell outline preserved. Okay, but in liquefactive necrosis, cell outline is not preserved. Cell outline is not preserved. Okay, so do remember friend, लिक्विफेक्टिव नेक्रोसिस में सेल का आउटलाइन प्रिजर्व नहीं होता है, लेकिन कोगुलेटिव में सेल का आउटलाइन प्रिजर्व होता है. ओके, देन it comes to some example. Okay, so here is some examples like in coagulative necrosis there is burns, or like dry gangrenes, and also Janker degeneration. Okay, and liquefactive necrosis example here is brain abscess. Okay, fungal infection, and caseous necrosis example tuberculosis. ओके, ट्यूबरकुलोसिस में क्या दिखता है, केजिएटिंग ग्रेनुलोमा. ओके, एंड ऑल्सो केसिस नेक्रोसिस में फंगल इन्फेक्शन लाइक हिस्टोप्लाज्मोसिस, कोसिडोमाइकोसिस. Okay, so it is all about coagulative necrosis and liquefactive necrosis and caseous necrosis. Then we comes to fat necrosis, fibrinoid necrosis, and gangrenous necrosis. Okay, so here is types of necrosis. Okay, so first one is fat necrosis, fibrinoid necrosis, and last is gangrenous necrosis. Okay friend, so here notes, fat necrosis basically due to enzymatic or traumatic. Okay, and fibrinoid necrosis, it is due to immune complex. Okay, like deposition in vessel wall like fibrin. Deposition in vessel wall, so there will be fibrin like structure. Okay, fibrin like structure, so there will be fibrinoid necrosis. Okay, and in gangrenous there will be gangrene, dry gangrene or wet gangrene. Gangrene like dry or wet. Okay, so if you will talk about occurrence, means where its necrosis occurs. So in occurrence, it is trauma in breast, traumatic breast. Okay, then also due to enzymatic fat necrosis, enzymatic like omentum, pancreas, and mesentery. And fibroid necrosis, it is seen in type 2 or type 3 hypersensitivity reaction. It is seen in type 2 and type 3 hypersensitivity reaction. Okay, and gangrenous necrosis, basically it is seen in lower limb. Okay, then there is example of this all three types of necrosis, fat necrosis, fibroid necrosis, and gangrenous necrosis. So first example of fat necrosis, there is pancreatitis. Like when there will be pancreatitis, so lipase will release lipase, so there will be release free fatty acid, and then free fatty acid will contact with calcium, and there will be a sponification. So how it will look like? Chalky white deposit. Okay friend, do you remember? There will be pancreatitis, so elevated pancreas enzyme, so lipase will release, and when lipase will release, so it will release free fatty acid, and when free fatty acid will release, so free fatty acid will contact with calcium, and when free fatty acid will contact with calcium, so there will be sponification, and after that there will be appearance chalky white appearance, so chalky white deposit. Then we comes to example of fibroid necrosis. So there will be scoff nodule. Okay, it is basically seen in rheumatic heart disease. Okay, and also malignant hypertension. Or there also polyarthritis nodosa. Okay, it is called vasculitis. So friends, this is all about necrosis. Here is all types of necrosis, so it is very important topic from MCQ exam point view. Okay, thank you. Do subscribe and like my channel.